Hello, I'm Dr. AJ. I'm a family doctor practicing here in Halifax, Nova Scotia. In June of 2011, we held the 12th Canadian Collaborative Mental Health Care Conference here. Our 21-member planning committee had a single goal in mind. We wanted to break through the glass ceiling which currently separates people with mental illness and their families from meaningfully being involved in their care. Shared care of individuals and families that are dealing with mental health and addictions is what this conference was all about. This DVD contains snapshots of key presentations at the conference. We've put together the entire content of the conference online, and you can access it at shared-care.ca.
The whole concept of triangles of care and collaborative practice, which is what this conference is all about, professionals, those with lived experience of mental health problems, and their supporters, those people in their circle of support, which is sometimes blood relatives, sometimes extended family, sometimes a group of friends, neighbours, whatever it is.
Eventually, we had a crisis situation, and Mary went into the acute adult service at the age of just 17. And I suppose the overwhelming feeling was that we'd gone from a service that maybe didn't do psychosis, but we'd gone to a service that didn't understand the needs of young people, nor families, really.
For one, psychiatry, although essential, does not replace the wisdom of having worked with one's own mind on the level that peer support workers have had to. With their complementary expertise, they could also be leaders in the healthcare world, because they get it.
Combining traditional teaching, a video, and featuring people with lived experience, because we're learning through Opening Minds that direct exposure and contact with people with lived experience has the greatest impact.
The landlords, and we've got 36 landlords who came into this program with us who wanted to rent to the mentally ill. So what does that tell you? That tells you that the community, if you have a good program, wants to be part of it for mental health. 36 landlords in a small city like Moncton.
We need people who are going to really take a look at maybe is there some connection between why somebody feels sad and why their stomach hurts. And then maybe tease out, do we need to go and move on to other levels of specialty? And again, systems that include the patient's voice, the family's voice, the community's voice.
And more recently, and I think particularly here, it's certainly one of the takeaway messages from this conference, is to include the families, not to forget the families, but also to include them in as many ways as possible in new collaborative partnerships.
And you can access it at shared-care.ca. It's in the form of videos, PowerPoint presentations on a variety of topics: cyberbullying, suicide prevention, youth resilience and recovery, first-person accounts, mind-body-spirit integration. There's something for everyone. Whether you're someone with a mental illness who wishes to learn more, or a family member currently supporting someone with mental illness, or a health practitioner who's looking for ways to do things slightly differently and better than what you're currently doing. The virtual conference offers a spectrum of such presentations and gives you collaborative ways by which you can approach them and truly share the care.
And we also work in an environment that has economic constraints. So I think we do need to be clear, what is it that we need to do in secondary services? What can be dealt with in primary services? Where do you need collaboration? What can be addressed by voluntary organisations in the community who do other sorts of work?
This was published by the Agency for Healthcare Research and Quality yesterday. This is a research agenda that we have put forward for the United States as what we call prioritizing integration, prioritizing research around integration.
And remember, I'll never forget going to see Martin in his office to hear about the results of this year of work. And he said, well, David, it looks as though we're saving about £5,000 in the first year and £14,000 by year 3. And I thought, well, it's all right. And he said, no, that's per person. Right, that's per person. So there's 7,500 young people have a psychotic illness each year in England, And we're looking at a 3-year package of care, 22,000. So I think 22,000 multiplied by £14,000 is quite a lot. And probably quite a lot in Canadian dollars too.
Okay. And it may be too much to ask some psychiatrists to start with an I don't know mind, but maybe to start with an I don't know everything mind.
2 years ago, 3 years ago, changes in the training guidelines for psychiatry residents. We're just in the process of implementing this. All psychiatry residents in Canada need to spend 2 months in collaborative practice. And I think it's critical that we get this right. I'll talk at the end about some of our priorities, but I think this absolutely has to be one.
Just know that bullying has had a devastating effect on me, my family, her sister, her nephew, her cousins, aunts and uncles, and her grandparents. So hopefully today we can get some insight into what we can do to help the kids.
So the Commission, again, and its role as catalyst, is going to try to create that momentum, and I encourage and invite each and every one of you and your families, friends, everywhere to get involved when you hear about Partners for Mental Health in the upcoming months.
Collaborative care is a way by which we can all work together and improve our understanding of the treatment of mental illness and addictions. It supports our well-being, our families, our communities, our relationships, especially at times when we are at our weakest and most vulnerable. The mind, body, and spirit must be well in order for one to thrive and flourish. That is ultimately what shared care is all about.